Hi, I'm Dr. C. Have you ever had an MRI that showed nothing was wrong, and yet you're still in pain? That's not unusual. MRIs are powerful, but they're not perfect. They show us structure, not function. They're not pain scans. They just let us know if there's something obviously wrong with the spine. There's another problem with MRIs. If I were to take 100 people off the street who have never had a day of back pain in their lives and do an MRI scan of their spines, 2/3 of them would be abnormal, and yet they're asymptomatic. So how do you interpret these things? We use MRIs not to make a diagnosis, but to let us know if there's an obvious surgical problem. You may be having pain from mild disc degeneration, or from facet arthritis, or from a positional irritation of a nerve root, and the MRI still looks fine. And as I've said, MRIs can show all sorts of abnormalities in people who have no pain at all. So just because something shows up or doesn't show up on an MRI doesn't really tell you where your pain might be coming from. I've seen patients with terrible sciatica in a structurally normal MRI because their nerve root was being irritated by the chemical components of the disc. I've seen patients with sciatica and normal imaging that turned out to have something called a listhesis, and in certain positions, their vertebral bodies actually shifted it against each other and created nerve root compression. But the scan missed that finding. But the pattern of their pain made the diagnosis obvious. That's why you need more than just a picture. You actually need a pattern match. You need to understand what your symptoms might be coming from. And that is exactly what Pain Finder helps you do. It walks you through your pain story and shows you what fits based on real-world logic, not just images on an MRI. The Pain Finder tool is free. I'll post a link below. Check it out. See what you can learn. I'm Dr. C. Thanks for watching.